All right, so today we are going to discuss the NCLEX-RN Test Plan, the 2026. Okay, this one will be effective from April 2026. So if you look at the document, it's about 56 pages. 56 pages. However, you don't need to know everything in this pages. There are some key things you are supposed to know, and we've highlighted them for you. Okay. Let me tell you one thing. The NCLEX actually want you to pass the exams. They don't want you to fail the exams. They actually want you to pass the exams. So they've included everything you need to know in the exams. An examination that wants you to fail will hide a lot of things, but the NCLEX exams actually want you to pass. So they've brought out everything you need to know for the exams. And as we go through this document, you'll get to know everything about the exams. Okay. All right. So I'm going to scroll gradually. Okay. And when I get to the highlighted parts of the slides, I'll stop and then explain it for you. Okay. All right. So let's start. Okay. So there's the entire document, the table of contents. Okay. I'm scrolling very fast. Yes. Sorry, I think I went too fast. Okay. So there's a table of contents. Okay. All right. A test plan. All right. So the first you need to know about the NCLEX exams is about the examination structure. Okay. How the exams has been structured. When you were in school, you learn about taxonomy, the Bloom's taxonomy. If you went to nursing training school, you would definitely come across what is called a taxonomy. The taxonomy actually, we have what is called the levels, okay, the cognitive levels. So they will say, oh, this one is level 1, level 2, level 3, level 4, level 5, level 6. It's called the Bloom's taxonomy, and it is more like critical thinking, how you think and all that. And the NCLEX exams has incorporated this into the examination. Okay. For you to pass the exams, you need to understand how the examination is structured, how the test is structured. So the test has been grouped into what is called the client's need. The client's need. And if you read what is here, they said that the content of the NCLEX-RN plan is organized into 4 major client's needs. 2 of the 4 major client's needs have been divided into subcategories. So if you buy any Q bank and you open it, they will be like, oh, this side is for safe and effective care environment. Then you'll be seeing something like management of care, then infection prevention. Are you getting it? It's because the exams is grouped that way. And then also on the real examination day, you are going to be tested on all these areas. So let's look at the areas. So you have the first one being safe and effective care environment. Okay. And that is where we have the management of care. Then safety and infection prevention and control. So those your isolation procedures, you need to know it for the NCLEX exams. Your airborne, your droplets, your contact, your neutropenic precaution, you need to know them for the exam because they are going to test you on it. So if I say that the exam doesn't want you to fail, understand it because they are giving you everything you need to pass these exams. Then the second one out of the 4 is health promotion and maintenance. We'll look at the topics that fall under it. Then psychosocial integrity, your mental health, your therapeutic communication, your schizophrenic patient, your depressive patient, your bipolar patient. How are you going to manage them? Then we have the physiological integrity. And under it, we have the basic care and comfort. We have the pharmacological and then parenteral therapies. We have the reduction of risk potential. Then we have the physiological adaptation. So these are the major areas to master for the NCLEX exams. These are the areas to master for the NCLEX exams. Any question before we proceed? Let me come to the page and see whether I have any question. If you have any question, kindly ask, okay? If you have any question, kindly ask before we proceed. So these are the client's need. These are the areas the NCLEX will test you on. Any question before we proceed? All right, let's continue. Okay. So we've already spoken about the areas to focus on, right? All right. And they know that as a nurse, you have to be caring. So that one, everyone understands this, right? You have to use the knowledge that you've learned from your school to critically think about what you are going to do. So we have what is called a clinical judgment. And for 2026 test plan, they've inculcated the clinical judgment into the test. At first, okay, clinical judgment was more like a trial, something that they were doing. Those who have written the exams before, they go there and there are some of the questions that are not scored. There are some they will be telling you, these are pre-test, these are non-score, these are like this. Okay, they were taking responses from all the candidates. So after some time, okay, I think in 2024, they collected about 24,000 responses from new grads, new nurses who are practicing. So let's say you finish school today, you get a job tomorrow, and you start practicing. They will come to you and be like, "Hey, how was the examination that you wrote, the clinical judgment part of it? How was it?" So most of them said that, "Oh, it was good." So now they have fully inculcated the clinical judgment into the test, and we are going to look at it. Okay. So the clinical judgment also uses the Bloom's taxonomy, the cognitive level. Okay. But don't worry about all the taxonomy that they are saying. Just master your content. Okay. So any question you take on the NCLEX exams will either test you on recognizing the clues. So if you look at your case studies, okay, they will bring the patient vital signs, medical history, and all that. Okay. Then they will also test you on how to analyze the clues. Okay. So if you look at it, recognition of the clues. Okay. We have you identifying the condition. So let me give you this example. Okay. Let's take antipsychotics as an example. Let's say your patient is on antipsychotics. Okay. Antipsychotics. And then your patient is showing signs of what's the name? Your patient is showing signs of NMS. So they will come and they will tell you that the patient is having fever, muscle weakness. Now they will put all those things in the question. They will tell you the patient was on any of the antipsychotics. Okay. Then the question will go ahead and tell you that the patient was having muscle weakness and all that, in addition to fever. So recognizing the clues in here, they need you to identify those areas that are of a concern. See, when you are solving your Q bank, your case studies, they ask you this question: which of them is of a concern, right? Good. Then the next one will be like, what is the patient suffering from? They will bring Parkinson's disease, they will bring NMS, they will bring EPS. NMS is neuroleptic malignant syndrome. EPS is extrapyramidal side effects. Then they will bring other conditions just to confuse you. So if you are able to analyze the clue in the question, you can tell them, oh, this one is NMS. How many of you are following what I'm saying right now? Yes. Let me know. Then someone will be like, let me know. Right. Good. Good. All right. So Mariam says yes. So you see how the case studies that you are going to solve on the NCLEX exams is arranged. They've already told you what to expect. So what is your fear? Then the next one will be the prioritized hypothesis, the agency, the likely risk, difficulty, time constraint, and all that. Then the NCLEX will now go ahead and ask you. So right now that you know that the patient is having NMS, which solution do you think the provider will bring, or what will you do as a nurse? I'll be like, oh, they have to stop the medication, right? You have to give dantrolene. You make sure that the provider prescribes dantrolene to give to the patient. You make sure that this patient is sent to the ICU. You are taking action. You implement the solution. Then you evaluate the outcome. So that is clinical judgment. Whenever you are solving any case studies, when you see your case studies on your NCLEX exams, think about what I've just told you. Analyzing the clue is easy. The answers are in the case studies. Yes. Just go back and ask yourself, which of the following is normal? Which of them is not normal? Which of them is an expected outcome of the condition? Which ones are not expected outcome of the condition? If you know the difference between these two, you will be able to answer the questions with ease. Okay. All right. Let's proceed. So before already spoken about the distribution of the contents, remember I told you the 4 key areas to focus on, right? So let me read this part. It said the percentage of the test question assigned to each client's name category and subcategory of the NCLEX-RN Test Plan is based on the results of the 2024 RN practice analysis, linking the NCLEX-RN examination to practice, that is the NCSBN 2025, an expert judgment provided by the members of the NCLEX examination committee. In addition to this, in addition to those needs areas, those 4 needs areas, okay, clinical judgments will be given to you in 3 item sets. So you are going to get 3 case studies. Every NCLEX test taker will get 3 case studies. Each case studies will be about 5 to 6 questions. So in all, you are getting about 18 questions that are from the clinical judgments. Okay. And then out of the 18 questions, 10 of them, or let me say, not 10% of them will be a standalone. When we say standalone, they are questions that bring an option like 1, 2, 3, 4. And that's it. It's a case studies, but that's it. Just one question. That's what a standalone. Standalone. Okay. So remember, the NCLEX exams, aside testing you on those 4 client areas, okay, these 4 client areas, the safety, the health promotion, the psychosocial integrity, and then the physiological integrity, all that. They are going to bring 18 questions that are clinical judgment questions. The juicy parts are coming, so hold on. Okay, so these are the distribution. Okay, the physiological, the management, the percentages you are to know for the NCLEX exams. Okay. So you can't go to the NCLEX exams without learning mental health, because your psychosocial integrity carries about 9%, basic care and comfort 9%, your pharmacology, and then the other parenteral nutrition, no, not parenteral nutrition, parenteral therapies, because parenteral nutrition is different from parenteral therapies. Your pharmacology is covering about 16% of the exams. Risk reduction is 12%. Physiological adaptation is 14%. Management of care is 18%. So they've already told you the percentage that is coming. Do you have to fear taking the exams? No. No. Okay. Let's move on. Okay. So the content that the NCLEX bring to you, okay, they always review it every 3 years. We are in 2025, right? So in 2022, they brought a test plan. Okay. So they review it, and that one took effect on, I think, 2023. And we've used it till 2025, 2026. So the next 3 years, they are going to review it again. So the studies is not ending. They are always making their studies, always making their research to make sure that the exam that you are going to write actually matches what is done on the ward or in the hospitals. Okay. Good. How many of you remember the 4 key areas? Is management of care part of the 4 key areas? Let me know. Yes or no? Let me know your answers in the comment section. Is management of care part of the 4 key areas? Yes or no? Let me know your answer right now. Yes or no? Is it part of the 4 key areas? Let me know your answers. Is it part of the 4 key areas? Let me know. Oh, yes or no? Let me see your answers. Yes or no? Let me see your answers in the comment section. Yes or no? Good. Good. So it is yes, right? The answer is yes. Okay. If it is a yes, then what are the topics you need to know for management of care? Which examination will tell you the areas to go and learn and come and write the exams? Okay. So we have perform procedures necessary to safely admit, transfer, and discharge of patients. Yes. How many of you remember MTALA? MTALA is part of the procedures, the things you have to know for admission, right? MTALA, emergency medical, right? MTALA. So if you look at MTALA, you can't send a pregnant woman away if she's in labor. You have to know that for the NCLEX exams, right? How to hand over a patient, client advocacy. These are all management of care. So they've told you the areas to focus on. Your education. So these are the areas. So if you read through it, you see that they are telling you what to know for the examination, right? Admission and discharge. Delegation. See, delegation is right here. Delegation is right here. Let me use my pencil to highlight it for you. There is a delegation, right? How to delegate as an RN. So if you are solving questions on your Q bank, then they'll be asking you questions on delegation. It's because the NCLEX need you to know before you go and sit for the exams. Client right is also here. You can see it, right? It's there. So these are the areas you need to focus on when it comes to management of care. Yes, when it comes to management of care, receive and verify and implement healthcare providers order. So in some of the questions they will ask you, is it appropriate to give this medication although the provider has prescribed it? At times they will tell you, which of the following orders are you going to question? It's because the test plan included this. You need to verify, receive, verify, and implement healthcare providers orders. Right. So we have a whole lot here that you can go and then read on. Okay, you can go and then read on it. Yes. All right. So let's move on. Remember, safety and infection prevention and control. Remember, I told you that you have to know that one too for the NCLEX exam. So see, it says apply principles of infection prevention. So hand hygiene, the steps for hand hygiene, aseptic technique, your donning of your PPEs and all that. Universal and standard enhanced barrier precautions. All right. So these are all the areas to focus on. All right. So yes, when you get a document, try and then go and read everything. We are not done. We've just spoken about two areas, right? Health promotion and maintenance. That one too, you see, it says provide prenatal care and education. What will you tell the pregnant woman? Which education are you going to give them when they are having breast engorgement? Mhm. Are you getting it? All right, just a minute. Okay, let me do this and come back. Just a minute. All right, let's continue. So this is health promotion and maintenance. How are you going to educate your patients, especially your pregnant woman? Okay, um, it's all about education. Okay, provide postpartum care and education. Anything about education will fall under this aspect of the examination. Your preschoolers, your adolescents, they are all here. The kind of education you have to give them. So if I tell you the examination actually wants you to pass, NCSBN actually wants you to pass the NCLEX exam, you have to understand me now. right? Okay. So that's it. That's it. So physiological integrity, that's psychosocial. Psychosocial will talk about your mental health, what you are supposed to know when it comes to mental health, right? So we have them also here. We are not done. Physiological is also here. But let's move straight to the other important areas of today's examination and today's lecture. Okay. Now, as a candidate, okay, you are going to write an examination and you need something about the exams on that very day. Let's say you are going to write today, today being the 20th of December, you are going to write today, right? You need to know the length of the examination. You need to know how the examination is being administered to you. You need to know the number of questions you are going to answer, aside you knowing the key areas for the examination. So we have what is called the administration of the NCLEX exams. This is the NCLEX-RN exams. Okay. Now, the examination is still based on the CAT system, the computerized adaptive testing. Now, the CAT system uses technology, AI technology, to test you. So if you say AI is not good, then you are saying that the NCLEX exams, hope you get the angle I'm coming from. Okay. If the NCLEX exam is using AI, then that means that as a nurse, you need to also be using AI tools to be learning. They are always making a research because this one he says that it's a computerized adaptive testing. Okay, that matches your knowledge based on the way you answer the questions. Okay, so in the NCLEX exams, they have what is called the question pool. Okay, and then each of them has been classified into the various levels. The four areas that we spoke about, each of them have been categorized in those levels, in addition to the clinical judgment. So when you go there, the computer will now throw in those questions for you. Okay. So we don't have like 150 questions selected for only you. No, it's a question pool. It's like the commercial bank. Okay. Let me say the central bank. Central bank. They have a lot of money in there. So when you come, they can give you cedis, they can give you pounds, they can give you euros, they can give you dollars. You don't know the kind of question you are going to get. However, the difficulty of all those questions have already been placed in the system. So the system actually knows the kind of question to give you based on how you answered the previous questions. So in here it says what? Based on the client's previous answers. So depending on how you answer the previous question will determine the kind of question you get next. Okay. So it's like you going to a gym. When you go to a gym, you don't start lifting metals. Who. No, you don't do that. You start warming up, right? You start warming up. Footballers, when they want to, when we are exchanging someone, okay, you see that the person at the bench is warming up. Good. So the NCLEX examination too is the same. They will give you questions to warm up. So initially, when the candidate starts answering the questions, they will be like, oh, initial questions was easy, or I was just answering them. But it got to a extent that I felt lost in the examination. Yes, it's because the examination has taken off. Yes. Initially, they were just joking with you. You know, they will throw the question and then you answer it. Like, oh, this person is good. They will bring another one, then you answer it. This person is good. That's the way the CAT system operates. So it gives you questions based on your previous answer. All right. Has the length of the examination changed? No, it has not. The length of the examination has not changed. You have a minimum of 85 items, 85 questions, and a maximum of 150 questions. And it is still 5 hours. So if you check here, it's still what? 5 hours. However, please listen to this. This is the icing of the cake. However, out of the minimum questions you are going to answer, out of the 85 or whatever question that you are going to answer, okay, 52 of the items will come from the 8% areas. Those, you saw me giving you some pie charts. It will come from that area. 52 will come from that area. All right. And then 18 will come from the clinical judgment, from the 3 case studies, and the 10% of it being the standalone. Remember, I explained this earlier to you, right? If you add that one to 8, how many questions have you gotten so far? Let's do the maths, okay? I need you to do the maths right now. Open your calculator, let's do the maths. Because we are at the icing of everything today. Let's do the math. We said 52 questions will come from those percentage areas, right? From the pie chart, right? So let's do 52. Now, we said that we are going to get clinical judgment questions, which is 18 questions. Now, add 18 plus 52. What do you get? Let me see your answers, please. Let's do this together. Let me see your answers. 52 plus 18. What did you get? Good. 70. You had 70, right? We are still not done. We are still not done. Okay. Now they said the remaining 15 items will be unscored pre-test items. So add 15 plus the 70. What did you get? You had 85. Good. So on your NCLEX exams, 15 of the items are not marked. It's surprising, right? They only mark the 52 plus the 18 items. So in all, they need 70. 15 of those items are not marked. They are not marked. Any question before we continue? Any question before we continue? So if I actually tell you that the examination wants you to pass, people will be like, hey, and Prof. Nui is saying that it's not fair. Yeah, so 15 items are not marked. It's just 52, and that of the 18, making what? 70. And then the 15 of the items, that one, it is not marked. And you not even know the items which are not marked. You don't know. I don't know. But in all, you have what? 5 hours. 5 hours for the NCLEX exams to complete everything. Okay. All right. Now let's go to how the examination is being scored. Okay. So the pre-test, those 15 questions, you don't even know that it is not even marked. Okay. Yes. Now let's move on to another key area of our test. Passing and failing of the exams. So most at times people come back and be like, oh, I finished at 85, I finished at 92, I finished at this. Most people will be saying that if you finish at 85, it means that the examination has automatically passed you. People will be like, I'm going in there pass at 85. Then when you get to 85 and the examination is not ending, they become frustrated and now start messing up. So many people, I always tell them that, hey, go in with the idea that you are going to answer all the 150 questions. You are not going there to answer 85 questions and come back. No. 5 hours. That's 5 hours to answer those questions. 300 minutes, 2 minutes for each question, which is enough. So just go in there with that mindset so that you don't freak out when it is 85. Because that anxiety alone is making a lot of candidates fail, not because they don't know, but because they felt anxious and started answering the questions anyhow. No one will ask you that which number did you pass? As I'm here, no one has ever asked me which number did I get before I passed. No. So the person who passed at 85, the other person who passed at 90, the one who passed at 150, 120, 130. At the end of the day, the exams will come as pass or fail. So why then will you worry yourself going to think about whether you end at 85 or 150? Don't go and worry yourself. Don't worry your brains over those things. Okay. All right. So we have the first scenario. The first scenario usually is utilized when you get to the 85 questions. So at 85, it says that if the computer has gathered a lot of information about you and it is 95% assured that you pass or you fail, the computer will shut off. So if the system is 95% sure, it's like you are writing an examination and you are getting everything correctly. 95 over 100, the computer will shut off. What if you are 90? Does it mean that you are doing poorly? Let me know your answer in the comment section. If you hit 90, does it mean that you are doing poorly? Yes or no? 90, let me know. Yes or no? Good. It means that you are still in the game. So do you expect the computer to shut off? No, it won't. So that's why I'm telling you this, that you need to focus on you finishing the exams, because it could be that you are at 90% at 85, so the computer will not shut off at that level. It will still be giving you the questions to see whether you maintain that 90 all the way through. It just needs you to hit the 95 and shut off. But most of the time, people start freaking out at this very point, and you see that they will feel anxious, and now the curve will start dipping and to become going down, going down, going down. Before you realize, it is hitting the below the passing line. Hope you are getting how the examination is structured. You are at 90%, so the computer is telling you keep going, keep going. You are doing well. You are doing well. You are doing well. Then, because of anxiety, it will just go and destroy what you are building. So go in with the mindset of answering 150, not 85. So most of the time, if it shuts off at 85, or let's say any number, it means that the computer has gathered 95%. The computer has 95 confidence in you that you are going to pass the exams. Now, what if you answered all the 150? That's the second scenario. So if you answered all the 950, that 95% rule will not affect you. The only thing they are going to use is the passing line. So the passing line is more like the zero, the positive number and a negative number. So if, let's say, let me give you this example. Okay, it's an example that I'm using. 100%, and the computer needs 95% to determine whether you've passed or you failed. It didn't get to that 95% confidence. So it tells you, okay, I'm no longer going to use the 95. So let me use something like 50%. If you get anything below 50, you failed. If you get above 50, you've passed. So they have what is called the 0.0 rule. At times they'll say 0.01 or 0.1 rule. Okay. So it's just like our graph that we know in primary school. In primary school. So that is what they are going to use. So if you're above the passing line, then they will say you've passed. Hope you are getting it. Good. And then what if you run out of time? If you run out of time, that one too, the computer can use the 95% rule. I've never seen anyone running out of time. No, because they've given you plenty time to answer the question. So that one too, they are going to use the above and then below the passing line. Okay, that's what they are going to use. Then how is the examination scored? So the examination is scored on this principle, the partial credit. So it is plus or minus 0 or 1. Are you getting it? 0 or 1. That's what they are doing. So I always tell my people, when you get a SATA and you don't know the other answers, please leave it. Don't choose anything that will go and destroy the answers that you've already chosen. No one is forcing you to choose. So you choose what? The ones you know, and then leave the ones you don't know, because it is plus 1 minus 1. Maybe the one you are going to choose will be an incorrect answer. Always rely on your instincts. You've been in the class for a very long time. You know how we answer questions. So dwelling on your instinct is the right thing to do. My people will tell you that they will be hearing the voices of the tutors in their head. Yes, that is your instinct. You don't choose anything. You don't gamble. Okay. Because you've worked so hard to get this. Okay. Now, some terminologies they are going to use on the NCLEX exams, they will use the client. The client representing the patient, the individual, the group, those significant others, those relatives. Then they are going to use terms like the order. Okay, the order is just talking about the intervention, remedy, treatment, anything authorized by the primary healthcare provider. That is the order. Then the prescription talks about the intervention, like medication that's related to the patient, and that one too is given by the healthcare provider. Then who is the healthcare provider? Anybody who can prescribe. So the NP, the nurse practitioner, can prescribe. The surgeon can prescribe, the nephrologist can prescribe, the physician can prescribe, the medical doctor can prescribe. Any of them, the DO, any of them, they are all called the primary healthcare provider. Okay. Then you have another term like the UAP, unlicensed assistive personnel. They are not licensed, they are there to support you with the nursing responsibilities. Okay. Any questions so far? Any questions so far? Any questions so far? If you have any question, kindly ask. Any question? You can unmute and then ask your question.
Hello, good morning, boss.
Hello, good morning, Barbara.
Please, my question is, I didn't get the list for please. The medical doctors, are they part of the primary healthcare providers?
Yes, they are part of the primary healthcare providers. Okay, they are part of the primary healthcare providers. So anybody who has the authority to prescribe. Okay, anybody who has the authority to prescribe. So the nurse practitioner is there. He has the prescriptive authority. The surgeon has the prescriptive authority. The medical doctor, anybody that can prescribe medication, that can prescribe an intervention. Okay, yes. Is part of the primary healthcare provider. All right. Any more questions? If you have any question, kindly ask. So you see, I always say that the NCLEX exam, they need you to pass the examination. They don't need you to fail. That is the system for you. They need you to pass the exams. They don't need you to fail. Because they've given you all the areas you need to master to pass this examination. So if I scroll downwards on this 2026 test plan, it tells me the areas to focus on. Okay. It tells me, so if it's advanced directive, okay, what do I need to know? It's telling me that, hey, you need to know living will before you come. Healthcare agent and proxy. These are fundamentals. Your POA, that's the power of attorney and healthcare, right? You need to know this. Okay. So if I'm still moving on, advocacy, how am I going to advocate for my patient? If I see any patient who comes in with bruises, won't I report? I have to report because as part of the test plan, you need to know your advocacy. Hope you get it. Hope you are getting it. Right. Delegation is also here. How am I going to delegate my tax to the LPN? It's in there. Right. What are the rights of delegation? And it's also here the right task, the right circumstances, the right patient, person, that's the right person, then the right direction of communication. Then lastly, you have to supervise, make sure that whatever you told them to go and do has been done. It's so simple. So if you go in here, you will see everything you need to know for the NCLEX exams. So when you buy a Q bank, the Q bank is just testing you on these areas. What is the role of the case manager? They just coordinate care, right? Client's rights. So if you go through the document, you can see that, oh, they've given you everything you need to know for the NCLEX exams. Any question? Any question? So let me ask you, is the exam that difficult? After going through what I've told you today, is the exam that difficult? Do they actually want you to pass? Yes, they want you to pass. That is why they are giving you this information. Just study, and you will get your US license. You will get your Canadian license with ease. Okay. All right. So let's do this question. So the nurse has been made aware of the following client situation. The nurse should first assess the client, and they said what? With diverticulitis, who is reporting left lower quadrant pain. Okay. Then a patient with COPD who is reporting hemoptysis. Then third one says that who has had evacuation of subdural hematoma 8 hours ago and has become agitated. These are prioritization. And he said what? 4. Who has had total knee replacement 8 hours ago and has been whose affected extremity is internally rotated. So you ask yourself, which of them, if I don't intervene within some constraints of time, will have the worst outcome? That's what we are looking for. A person with diverticulitis having pain, it is normal. COPD, it is normal for you to see them reporting those hemoptysis. If you've gotten those total knee replacement, they work on your knee and you are getting those internal rotation, fine. Yes, we will attend to you later, but not now. But someone who has had subdural hematoma, that is the brain, and the person is becoming agitated. What do you think is happening? What do you think is happening here? What do you think is happening here? Is the level of consciousness changing? Yes or no? Is the level of consciousness changing? Yes or no? Yes, increased ICP, increased intracranial pressure. That is what they are testing you on. So someone who is having change of level of consciousness with someone who has had total knee replacement, someone's leg, and someone who is having brain issue, who will come first? Yeah, so that is the answer. All right, let's move on. So all these areas are topics to focus on. Okay, now let's answer this. They said the nurse is assigning UAP to assess the following clients to ambulate. It would be important for the nurse to review safety precaution with the UAP prior to ambulating there. So we are looking for a client who is unstable, right? So in here it says that a 44-year-old with Meniere's disease. In this condition, what do you think happens to them? Do they have balancing issues? Meniere's disease. Good. Balancing problems. So among all of them, do you see any of them having a balancing problem? Presbycusis, someone who can't hear properly, fine. You can still hold the person direct. But look at a person who is having a balancing issue. That means that this person, if you don't hold the person well, the person will fall down. Which cranial nerve is responsible for our ears? Which cranial nerve? Good. Cranial nerve 8. So on your NCLEX exams, they will bring cranial nerve 8 and they will ask you, what are you to assess? Balancing, right? Good. So you can't go to the NCLEX exams without knowing this condition. And knowing this condition, you should know that it affects balancing. I miss rapid review right now. Okay, let's solve this question too. So you see, all the question that we are bringing right now is testing you on the 4 areas that we spoke about. Or let me say, those percentages. They are about 8 or so. Those percentages, right? The nurse is teaching a client at the community health fair about risk factors for developing cancer. The nurse should recognize that at the highest risk. So we are looking for the one with the highest risk of developing cancer, right? Okay. So if you look at the option, it says what? A 30-year-old who consumed a diet high in selenium and has a history of ovarian cyst. A 49-year-old who drank 2 to 3 cups of coffee daily and has a family history of fibrocystic breast condition. Then it says a 51-year-old client who has hypertension and teaches an aerobic exercise program. That person in crowd does not even come. A 62-year-old client who consumes 5 to 6 alcoholic beverages daily and is an opera singer. Opera singer. Okay, so the age predisposes the person, the alcohol predisposes the person, and then a voice constraint. Like, an opera singer, you have to strain your voice. I don't want to use the singer as an example right now. This one is just for an educational purposes. Okay, it's just for an educational purposes. All right. How many of you have heard about Celine Dion? Celine Dion. How many of us here listen to her music? Let me know. Oh, let me know. Let me know in the comment section. Let me know. If you've never listened to her music before, just say no. How many of you here? Oh, let me see. Good. Everyone here has listened to her music before. She has a nice voice. But do you know that currently she can't sing anymore? She has lost her voice. Yes. Yes. So singing higher pitch actually predisposes you to some of these throat cancers. Okay. So the factors actually increases when you combine the other root causes. So here we are looking for the one who is 62-year-old who consume alcohol. So you know alcohol actually causes cancer. Your age actually changes the way they behave. And then singing too. Well, someone will be tempted to go and choose coffee, but just that coffee causes hypertension. Okay, it just gives you hypertension. Just gives you hypertension. Well, 30-year-old will have some risk, but the risk is not compared to someone taking alcohol at the old age. Okay, all right. Then physiological integrity, we have other, that's the psychosocial. Those your mental health patients, end of life care, grief and loss, and all that. Okay. All right. So we are scrolling. Okay, we have a question here. Now, this is where I need most of you to pay attention to how SATA operates. Okay. So he says the nurse is talking with a client who has had colostomy, hope you know colostomy, created 2 days ago. Which of the following statements about the client will indicate ineffective coping? Select all that apply. That means that the patient is not trying to accept that he or she now have a colostomy. The person's like, what is this? They are still rejecting their body image, right? So he says that I am not touching that disgusting bag. It's part of you now. So if you say that, that means that you are not coping effectively. The second point says that I am glad I can still go to the gym just as I used to. Yes, you can still go to the gym, just do your walking, you can do all those things. It's a gym. I really like raw vegetables, and it will be hard for me to limit them. You see, raw vegetables, you know, increases peristalsis, but mind you, it can also cause infections. Here, the patient is bringing out their concerns. So they are looking for solution, how they can adjust. I understand the need of the colostomy, but I'm afraid that the bag will leak. They are showing concern. The fifth one, which also shows ineffective coping, says that I do not understand why I cannot have a nurse perform the colostomy bag changes for me. You've been having this bag for 2 days. They've been changing it for you. You still need a nurse to come because you feel it is disgusting. Hope you are getting it. So when they say that, they are not coping effectively. So this is the mental health question. All right. Basic care and comfort. Aha. How many of you remember this question? Let me know. Those in my private group. How many of you remember this question? Good. It says that the nurse is teaching a client who has had subdural, subtotal gastrectomy about ways to prevent dumping syndrome. The nurse is teaching a client who has had subtotal gastrectomy about ways to prevent dumping syndrome. Which of the following food would be appropriate for the nurse to recommend eliminating from the client's diet? They brought cheese. Hope you know where cheese is coming from. They brought red meat. Hope you know red meat. They brought ice cream, and they brought yellow vegetables. What is the root cause of dumping syndrome? Dumping syndrome, where we have high dumping syndrome. What is the root cause? Let me know the answer really quick. Let me know the answer really quick. Let me know the answer really quick. What is the root cause of dumping syndrome? Rapid gastric emptying of what? Look at ice cream and look at red meat, yellow vegetables. They all go fast, right? Look at the way ice cream is. But we are looking for something in the ice cream. Cheese will also melt. How can tell me the answer? Not gas. No. Sugar. The high sugar content that will draw fluid from our blood vessels onto the GIT. So here they are telling you that the ice cream has a lot of sugar. That is why it can cause dumping syndrome. We spoke about this last week. It should be this week. Yes, dumping syndrome. All right. So that's it. The NCLEX actually wants you to pass. Let's do this question too. Okay. That will be our last question for the day. Yeah. The nurse is preparing to administer prescribed otic drops to a 1-year-old client. Which of the following actions should the nurse take? 1-year-old is just a child, right? So the first one says that gentle pull the pinna upward and straight backwards to straighten the auditory canal. Which people do we do this for? Which people do we do this for? Let me know the answer. Adults. You see? So here you have to know how to administer eardrop for an adult and then a child. They've given you the age, 1 year, right? Okay. Then administer the drops immediately after removing them from the refrigerator to minimize the risk of bacterial growth. Most of the ear drops, do we keep them in the fridge?
No.
No. No. The answer is no. It says 3 says direct the eardrop along the side of the ear canal to avoid instilling the medication directly onto the eardrum. You don't want the medication to hit the eardrum, right? You don't want it. So that is what you have to do. The 4th one says that gently massage the area immediately posterior to the ear after instilling the drops to facilitate the distribution of the medication. Do you go and massage? Have you seen some before? Have you seen us massaging the ears before? Yes or no? No. So I always say that at times people choose answers that they don't even know. This is a dumb answer for someone to go and choose. You've never done the thing before, then you go and choose. No, your instinct should tell you that I have never done this before. So that answer I'm not going to choose. Let's continue. I think we are done. Oh, I saw one more question here. Let's do it. Okay. The nurse is caring for a client who is scheduled for lumbar puncture. It will be important for the nurse to assess the client for A, bowel and bladder function, presence of Trousseau sign of increased intracranial pressure, circulation, movement, and sensation of the legs. They did a lumbar puncture. Well, we may be worried about bowel and then bladder function. Do we have to take that one as our priority? Although it's a priority, but compare that to an increase in intracranial pressure. Using your way of prioritizing, you will see that your increased intracranial pressure is more urgent than your bowel and bladder function. Hope you are getting it. Yes. So that is your answer for this question. I think we are done. I think we are done. I think we are done. The others, I think we are done with everything. So all these ones are like topics for you to, focus on. Topics for you to focus on. Yes. So when you get a file, try and then read the topics, okay? Yes. UTI is there. Let's solve this last one, then we can call it a day. So the nurse is assessing a client with viral meningitis. Which of the following finder would the nurse expect to observe? So they are asking you, when you get viral meningitis, what will be the signs and symptoms? That's what the question is asking. You can get nausea and vomiting because the condition affects the brain. Meningitis, the brain. Whenever there is change in level of consciousness, nausea, vomiting is something that is constant. Pillow erection is not there. Bradycardia is not there. However, we can get photophobia because it is also what? A neurosign. Nausea, vomiting, photophobia are all neurosigns. So if I tell you the examination actually need you to pass, someone will be like, oh, it's not true. Now, after going through the slide, tell me if it is true or it's not true. So this is the 2026 test plan. This is the 2026 test plan, and this is everything you need to know for the examination. They've given you the areas to focus on. They've given you how the examination is even going to be marked. They've even told you that do not panic at 85 because at 85, it is the system. If the system has not gathered 95 confidence about you, you still go, okay? You still continuously see questions. Maybe you are at 90, so that is not the time to go and panic. So remember, hitting 85 and still going does not mean that you are not doing well. It means you are doing well. It could be that you are at 80%, you are at 90%. The system needs 95 for it to shut off. However, it's still giving you the chance by hitting 150, and at 150 it will disregard the 95% and now use something that is lesser to grade you. The passing line, above the passing line or below the passing line. So why should you panic at 85? Don't panic at 85. Go, because you are going in there with the mindset of answering 150 questions, not 85 questions. Any question? Any question before we end the recording? Any question before we end the recording? All right. So this is NCLEX Suite Prep. We bring you the latest about the NCLEX exams. Yes. So right now you know the 2026 test plan. If you are preparing for the NCLEX exams, this is your number one place to come for your NCLEX prep. We teach you things you are to know for the examination. We don't teach you chaff. So if you are preparing for the NCLEX exams, get in touch. Let's set you up for the examination. Okay. Yes, we'll teach you. Most of our candidates are passing, so you can also pass. Yeah.